All right. Hi. Okay, hello everybody and welcome. Yeah, now we can start. Okay. We ready? Okay. Well, welcome everybody. Welcome to the first program in the 2012 season of Manatee Tiger Bay, our third year. It's a pleasure for me to welcome you here. I'm Judith Sedgeman, and I am the newly, I guess, named president of Tiger Bay. Oh, no. And it's really exciting for me to be part of this program. I've been coming to Tiger Bay meetings and thinking what a wonderful opportunity this is for Manatee Countyans to come together, people from a lot of different parts of the county, a lot of different walks of life, and find out about and talk about and ask the right questions about things that are important to our county. And it's really a great time to be in Manatee County. There's a lot of exciting things happening, but we also have a lot of problems to solve and a lot of issues to discuss. And so we hope that we'll bring all these things to life to you over the course of the year. And I want to also make sure that you all know that the purpose of Tiger Bay is for you to get up and ask questions. And so although we have to give you information to work from, and we start with the program, the success of this organization is tied to your involvement, your engagement, your running up to the microphone and saying, I've got a question. Of course, the trick there is to ask a question, you have to join Tiger Bay. So if you're not a member and you have a question, gosh, you maybe should join. Anyway, I'd like to welcome everybody here, and I'm going to very quickly tell you who the 2012 Board of Directors are. Ben Backer, Lisa Barnett, Bob Bartz, Betsy Benack, Rose Carlson, Ed Childs, Bob Christopher, who's our treasurer, Jim Delgado, Amanda Edge, Pat Glass, our founder, Karen Grablin, Ed Jennings, Dan Miller, Chris Pennewell, Greg Porges, Clayton Robertson, Misty Servia, Bob Turner, Jennifer Vignay, and I'm never sure I said that right, Matt Westerman, and Misha Wilson. These are wonderful people in the community who a lot of them are new board members for Tiger Bay, and they have a lot of enthusiasm for bringing you very high quality programming. So, hopefully we've got a great thing going. We are about to launch our new website, and it's pretty obvious. It's going to be www.manateetigerbay.org. So it's not like a big thing to remember. You probably can Google it. And on the new website, you'll find documentation for some of our programs. You'll find things that we put up of interest, pre-discussion sometimes, things that you might want to take a look at beforehand. We'll put up information about our speakers, information about our programs, and of course that all-important membership form. So you can join on the website. I want to take a moment to thank some people. I want to especially thank METV, our rock and our foundation. I think Charles Clapsaddle has never missed a meeting. And the wonderful thing is that if you loved a program and you have a friend who you really wish had been here, no problem. Just tell them to find it on METV and they can watch it in full. And that's a great advantage to our community. Charles does public service programming for every organization of value to the community, and we all owe him a great debt of gratitude. We have a number of committees that are hard at work for Tiger Bay. This is kind of internal. You don't need to know that, but I would like to say, would the Tiger Bay board members and committee members who are here just wave to be recognized? Okay, there's some back there. For you guys over here, there's some back there. There's a lot. All right. And also, thanks to Charles, and this is kind of an internal announcement, but I need the crowd's cooperation too. At the end of today's meeting, We're going to film a public service announcement for Manatee Tiger Bay in our all-important effort to encourage your friends and neighbors to join. And so we'll be filming it at the microphone or wherever Charles puts the microphone to film it, and where it's just going to take a few minutes, but if you mill around behind us, it'll look great. So if you decide to hang around afterwards and chat with your friends, would you please hang around kind of behind where we're filming? It'd be just wonderful. We'd appreciate it. Okay. No pressure there. Well, today's program is something near and dear to my heart. As most of you know, I have a deep involvement in health issues and have had for a number of years. And I was very fascinated to see Jennifer Benzie, our wonderful Manatee County Health Director, who I think is probably the best health director in the state of Florida. I kind of have heard people that know better than I do say that too. But anyway, I saw Jennifer make a presentation to a smaller group that gave a very telling health profile for Manatee County. I happen to be a member of this group, which is the Manatee, I have to let you know that, the Manatee Healthcare Alliance, which many of you may not have heard of, but you'll be hearing a lot more about it as time goes by. It's a relatively new organization of a very large group of very passionately committed healthcare providers, leaders, and people involved in the industry who are really determined to raise the health profile of Manatee County and make this a culture of health. And the Manatee Healthcare Alliance has its work cut out for it. And I thought this would be a great introduction for you to understand, first of all, to understand the problems that we face as a county and the successes that we've had too. Most importantly, to understand how we look in comparison to counties around us and to the state in terms of our health profile. And you might ask yourself, well, why should I care? And I can tell you why you should care, because every indicator of quality of life is reflected in the health status of a community. So when an industry comes to move to Manatee County, when a family decides they might like to locate here, when people are looking for places where they want to make an investment, one of the first questions they're going to ask is, well, what's your health status? You know, is this a healthy community? What's the quality of life here? How is healthcare delivered? You know, what is available for people? How are my employees going to be served? You know, do you have enough doctors? Do you have enough nurses? That's a whole other issue. But this is not people say, oh, that's a medical issue. It has nothing to do with me. That could not be farther from the truth. It has everything to do with every one of us if we want to make this the wonderful place to live and work that we know it is becoming. So I would love to introduce to you today the Healthcare Alliance, and I'm going to start. We have 3 people to speak. Jennifer Benzie is going to start. She's going to present that health profile. Please look carefully, and she'll explain what these statistics mean, because a good part of what her work involves is keeping and disseminating these statistics and making them available to us. Mary Ruiz, who needs no introduction, but of course who is the CEO of Manatee Glens, which is our mental health hospital in Manatee County and a wonderful facility. Mary plays a very, very important leadership role in the Manatee Healthcare Alliance and has had a leadership role in the evolution of all the healthcare decisions that have been made in Manatee County for the last number of years. And Mary's going to give us kind of a context for why this data is useful and important and why it's relevant to what the Alliance is doing and what the Alliance is doing. And then our last speaker is the president of the Manatee Healthcare Alliance and co-author of the fabulous new book, The New Health Age, which if you haven't read it, you must, because it is changing the conversation about healthcare in this country, who is our Bradenton attorney, Jonathan Fleece, attorney, author, and healthcare expert who's now becoming somewhat of a nationally known futurist, along with his co-author, David Howell. So Jonathan is going to give you the vision. You know, why do we have the Alliance? Where's it going? What's important for us to know? And then we're going to open the floor to questions. So with that, I'd like to start with Jennifer Benzie.
Okay. Good afternoon. Judy, thank you very much for your kind words. It's a pleasure to be with you today to talk about the state of health in Manatee County. In the past few years, the Robert Wood Johnson Foundation has been ranking the health of counties across the country. And in Florida, we rank 21st out of 67 in regard to the health of Manatee County. So that's good, but we can do better. So I'm going to share with you today some of the indicators that we look at. There are many, but some of them that are really the ones that we want to focus on in our community because they probably need some additional attention. Okay, Jonathan, next please. Thanks. And what we'll look at are the indicators, as I said. There's also county rates and comparisons. Everyone always asks how we're doing compared to Sarasota, even though we really aren't identical demographically. We kind of look at communities such as Pasco in terms of comparisons to mid-size county health departments and our work. So you'll see Pasco discussed, again, Florida rankings overall and some national rankings as well. And then what we're doing to address the problems here and our successes to date. If you look at leading causes of death in the county, you'll see heart disease, no surprise there, cancer, chronic lower respiratory diseases, the chronic bronchitis, emphysemas, stroke, and the injuries through motor vehicle crashes. Next, please. The biggest problem, not just us, but almost everywhere in the country, I think except Colorado, has a handle on this issue. Next, the obesity and the overweight. And again, this is 2010, but by 2011, Colorado was the only state that did not have the percentages of obesity that we see elsewhere in the country. First time in 2 centuries that our youth are expected to live fewer years than their parents. The obesity in children has tripled in the past 30 years. We're seeing it through diabetes, particularly in children. And again, both the children and the adolescents are facing this problem. If you look at the rates for us, 2010, you'll see it's better than the state, but again, nothing to be proud of. It's an issue we need to continue to focus on. And you'll see here that our adults really are having a problem here, with over 50% of them being overweight in the county. You can see those numbers there again, how we rank with some of the others in the state. And again, no one has anything to be proud of with those comparisons. Yeah. What we're doing here, we have a CDC grant at the health department called the Achieve, and many of you are members of that. And one of our areas that we focus on is physical activity, and we're working a lot and want to do more with the businesses in the community to focus on worksite wellness. That's really the place to focus on the adults. Through the schools, obviously, we're working with the children. We have progressive marathons. We have the parks and encouraging outdoor activities as well. Farmers markets throughout the community. We're very fortunate that we have that resource here. And then also working with the restaurants. We have a Healthy Choices program with Blake Hospital and about 25 restaurants in the community. So look on those menus for those healthy choices. Tobacco, always a concern because it does cause so many problems as it relates to cancer and other diseases. Next, please. Our adults we need to focus on. You can see the HP is Healthy People 2020. Those are national targets from the CDC. So we have some work to do there, but I'm very proud of the work that's been done regarding the youth in our community through programs such as SWAT, Students Working Against Tobacco, the Old Truth campaign. A lot of money has been put into this initiative, and we really are seeing payoffs. Again, you can see the adult situation. And then, Jonathan, next please. And then how we rank with the youth compared to others. So I think we're doing a great job there. Again, the Achieve grant, we have a tobacco committee as well, and doing a lot of prevention. Also, any of you who want to go smoke-free on your campuses, call me. We have the grants through the state to be able to assist you with signage and education. There's the free smoking cessation classes, but also the patches. So whatever you need, if you're serious about it, and I hope you are, please call me. The hospitals have already done that in the community, and we thank them. And schools are moving toward toward that as well. Again, a lot of opportunity here to make a real difference in someone's long-term health. Cardiovascular disease, next slide. This is always an issue, and really prevention and wellness, diet, exercise always makes a difference in how your numbers look when you go to the doctor for cholesterol and all of those other indicators. So you can see that it's on our radar. We know it's an issue. And you can see comparisons there again. We've got some work to do. Again, there's a lot of different programs through the state, through the federal government. We have one that's called Closing the Gap that focuses on minority populations, assisting them with risk assessments. What we're really finding out is that health fairs aren't the way. You really have to look at policy changes in your communities to really make a difference. We're looking at safe streets, more walkable communities, all of that. The tobacco all comes into play in really seeing significant change. I mentioned tuberculosis because it is an issue in our community, and it is around the country. As we all get older, our immune systems are breaking down, but we also have a migrant population here. So we see about 20 cases per year, which is not dramatic, but A.G. Holly Hospital, which is the state TB hospital, is closing this year. It's in Palm Beach. And we usually send about 2 cases a year there that are required to be there for up to 9 months. It's a long treatment process. But they need us to be in a secure environment and to make sure that they're taking their medication, because this is a very infectious disease. It can travel in the community very quickly. And Jonathan, if you could move forward, thank you. You could see that we want to focus on it because now with the hospital being closed, our hospitals locally are going to have to take on these patients, and it's a very expensive process. If they do need law enforcement for security for 9 months, that's another issue. So it's something we're going to be talking about soon with our partners here to make sure that we have a system in place for these patients. And you can see we do rank higher, again, more of a global migrant population here. What we have in the health department is direct observed therapy, where our nurses go daily to see these patients and make sure they're taking their medications, because again, it's a 6 to 9 month process that involves multiple drugs. And again, if they don't take them, we have a risk of it spreading through the community, and we especially don't want that in our school systems. So we do a lot of screenings as well in the jails, nursing homes, schools, to make sure that we are monitoring this closely. Cancer. Breast and cervical, again, as the population gets older, these are concerns for us, and we need to be watching our numbers going up here in the breast cancer population. And this, you can see the comparisons there. Again, a lot of it demographically motivated. Cervical cancer, same. But I think, Jonathan, go on the next. The partnerships are really what we have here through the state. Again, we have a CDC grant at the health department for eligible women to receive the education and the exams. But also the partnerships, again, with many of you in this room who assist us with those grants and assisting with the treatment as well. Melanoma, of course, where we live, it's something we need to focus on as well. And we do work with the Cancer Society on programs, and you can see the numbers there. And also tanning beds are an issue. We regulate them, and it's kind of a catch-22. We're saying, well, if we don't endorse them, why are we regulating them? So that's a big topic of discussion in Tallahassee right now as well, to stop this problem. Unintentional injuries, always in the top 5 of morbidity and mortality issues in a community. What these are range from the motor vehicle accidents, the motorcycle accidents, the bicycle accidents, falls, particularly in seniors, drownings. So something that we monitor, again, with our partners in the community. We have a ways to go, again, to reach those 2020 goals. And you can see the numbers there. The other issue with injuries is poisonings, and you hear a lot about the pill mills and the oxycodone and the issues that we're facing there. So a lot of what we're monitoring is this particular area as well. We're making very good progress. The medical community has come together in both Manatee and Sarasota. We actually work with a 4-county area as the CHIP. It's called Community Health Improvement Provocateur or Partnership, and it's all the health officers and the CEOs of the hospitals in Sarasota, Manatee, DeSoto, and Charlotte counties. And we take on initiatives every year that we all face, whether it's Clean Hand campaign for flu season or this issue. And Mary Ruiz has really taken this on and assisted us in guiding us through this process to make sure that Manatee County can be a safe place for those who are potentially going to be affected by this problem. In terms of the injury solutions, we have what's known as Safe Kids here. We work with the All Children's Hospital in St. Petersburg and many of our partners, EMS, fire, really focusing on how to do prevention and wellness as it relates to injuries. And then again, the drug misuse program that we're focusing on with the CHIP. And of course, in the Blake Trauma Center now being here, we've just written a grant with EMS and the Trauma Center, a national grant to focus on injury prevention as well in the community. So a wonderful resource. Okay, prenatal care, very important, long-term costs if it's not addressed early. And Jonathan, if you can move forward, please. You can see that this is a tremendous problem for us. And we're working very closely with Rural Health because they deliver 2/3 of the babies in Manatee County. And why are we having this problem? And so we're really going to be focusing on the data and trying to do a thorough analysis and what education needs to be done to get these women to the physician earlier in their pregnancy. And you can see our numbers here. Something that we definitely need to focus on for the health of those individuals. We do have the Women, Infants, and Children's program at the Health Department. We see 10,000 people a month through that program. That's the vouchers for the nutrition supplements for the children up to age 5. It's an opportunity for us to educate the parents at that time, and we do a lot of interaction in the community, sharing that resource with Healthy Start, for example, doing screenings. We want to do depression screenings with Manatee Glens. It's really a wonderful population to get to early on and educate in our community. And again, our partnership with Rural Health, we couldn't do it without them. They do the primary care in the community, so we work very, very closely together. Another area we're starting to make progress in, but again, we're unfortunately well known for this indicator, and that's not a positive thing. The teen pregnancy rates are slowly coming down, particularly in our 15 to 17-year-olds, but we still have quite a bit of work to do, as you'll see by the next slide. I think it really demonstrates the issue. Fortunately, we've had some wonderful programs in the last few years in the school system. And Jonathan, the next one is called TOP. You'll see the repeats we also look at as well, so that's kind of another indicator. So you can see there if we can get them in terms of early education. But these programs that I'm mentioning, I think it's on the next slide. Yes, thank you. The TOP, or the Teen Outreach Prevention, we have that for 9th graders in 4 of the schools in the county. And also It's Your Choice. We're in the middle schools. We also have a teen clinic on Wednesday afternoons at the Health Department. So we really are trying to look at best practices in the state and the country to continue to change these numbers for the better. HIV/AIDS, we have a wonderful team at the Health Department and a great community partnership with many groups in the area focusing on, again, education, early screenings. And you'll see, next slide please, that our rates are leveling off. It's still something we take great attention to, but the jail, we try to reach out to everyone. We've developed some new relationships with Starbucks, places that youth are at, the schools, colleges, high schools to do screenings. So it's really trying to educate as early as possible. And also in the older population now, those who've gone through divorce or widowhood and are dating again, we're seeing numbers increasing in an older population as well. So you can see the numbers overall in Florida quite high still. Same there. But again, a great team that we're working on, a lot of outreach to the different communities, and they spend their weekends working. My team is excellent in terms of really getting out there and trying to educate. STDs on the rise, particularly in the northern part of the state. We're seeing a lot of syphilis. So we want to make sure people travel, that we're monitoring in our community as well. And we do have these clinics, obviously, at the health department. You can see the numbers there as well. And education is key, prevention and wellness. That's what we're here for. Mary is the expert on this issue, but I will say that it is extremely important because you do see the comorbidities with the behavioral health and medical problems, with most people developing other indicators and cardiovascular disease, gastrointestinal problems, central nervous, pulmonary. So really it is something that it needs everyone's attention. And as I mentioned earlier, we're trying to do more screenings of people that we know could be susceptible to help find them early and be able to give them the assistance they need as early as possible. Dental care, another area where we've done a study this past year and we have a lot of information. The numbers of dentists in the community, lower than the state average. Billing, not a lot of our dentists take Medicaid in the community. There is a program called Healthy Kids, which is the state insurance program. We're trying to enroll more children in that program to receive services. And you can see the hospitals even have had almost 700 visits this year at a cost of over $300,000 because there was no access in the community. Fortunately, we have LECOM building their dental school, and I think the issue will be the transportation. I know there's been discussions already started about that because most of the clients who need these services are living downtown in this area, so how do we make sure we can get them out there? But we do have some programs in place currently now at One Stop and the school sealant program. Also, we wish we could do more with this. It really is a way to prevent if we can get to the second graders in the schools. And access, you'll hear more about this discussion with the Healthcare Alliance. Next, Jonathan. Individuals with no health insurance coverage continues to be an issue. I was at the Medical Society dinner the other night, and there was talk about, well, the rates may be going down, but they said that's probably due to those who are up to age 26 who are still being covered. And so that's probably the population that they're talking about. Of course, we're very fortunate to have WeCare here and all the physicians and healthcare providers who volunteer their services in that program. One Stop, again, Del was just telling me we ranked second in the country for our program, which is wonderful, and all the partnerships with LECOM and, again, Rural Health. Workforce, again, you have to have the providers to serve the community. I'm sure you know we've gone through some layoffs recently as a state agency, but we're still trying to provide all the services. It just may take a little longer. But again, the numbers of physicians and dentists there, and I know there's a lot of recruiting going on by the hospitals and the private sector to bring more providers to our community. I serve on the workforce board we have a bi-county healthcare committee, and we had a grant this past year that really focused on developing positions and promoting persons in nursing, allied health fields, PT, occupational therapy, physical therapy, et cetera, long-term care, which is something that's near and dear to all of us here, and the health information technology as more of the electronic medical records and the requirements come down for offices. This is something where people are trained in this area, they will be able to have very good jobs educating doctors' practices on how to become electronic. And you'll hear more about the Alliance in a minute. So actually, just in closing, determinants of health, really policy level, focused on the community interventions, but then the individual's responsibilities, and then having a quality healthcare system to serve all of us. So I thank you for your time. I believe we're going to save questions for later. Thank you.
Thank you, Dr. Benson. I think I'm always going to count as one of the highlights of my career serving on the committee that recruited Dr. Benson to Manatee County. It is with some amusement that I announce I've been invited to speak because I am old enough to provide historic perspective. So it's 1950 in Manatee County. The only hospital in Manatee County is run by Nurse Dovey Larrabee. On 9th Avenue in downtown, it's called Braden & General. You remember, yeah. And if a doctor forgot Nurse Larrabee's birthday, he was not allowed to admit patients to the hospital until she forgave him. So now it's 1960. Manatee Memorial was built in 1954. And the only ambulance service in Manatee County is run by the funeral homes. Your sick loved ones were picked up by the hearse for their trip to the hospital. If things didn't go well, they were supplied the return trip by the same means. And Dr. Dick Connard is here today, and he was one of the medical leaders that organized our first county ambulance service. The only reason we no longer rely on Braden General and Nurse Larrabee and her ilk and the funeral homes for ambulance service is that medical leaders came forward at the right time, presented a vision, and invited the community to support a new way to deliver health care in Manatee County. It's 1984. George Orwell has nothing to do with this story. The county hospital, built in 1954, is sold. I served on the negotiating team for the sale of that hospital for the county. The $45 million in proceeds from the sale were put in a healthcare trust fund to be administered by the county and used for indigent and general health care. Pasco County sold their county hospital about the same time, and they built a golf course with the proceeds. Wonder how that's going up there. I think Pasco has one of the lowest healthcare outcomes in the state. In Manatee County, the principal from this healthcare trust fund built with interest to over $60 million. And today we now fund indigent care provided by all 4 hospitals in our community: Blake, Lakewood Ranch, Manatee Glens, Manatee Memorial, and the physicians who provide and attend those patients, provide care and attend for those patients. It's not well known that for the majority of the years that this fund has been in operation, we also funded general health care needs, investments that we thought could transform the availability of significant kinds of care in our community. And an example is hospice. There was no hospice facility in Manatee County, and this fund allowed for the startup money for Tidewell to move in and open that house. I now believe they have 2 or 3 in Manatee County. We also used the proceeds. Chip Shore came up with a clever idea of bonding out and then retiring those bonds with the proceeds of the fund to build Manatee Glens Crisis Center. Today, it's the only children's behavioral health unit in the community. It generates $11 million in charity care every year. The Michael Bach Infectious Disease Clinic, when AIDS was getting to be more of a problem, healthcare providers didn't really feel prepared for the special needs of this community, and Rural Health now operates this clinic with the startup funding provided by the county, and it really is a national model for state-of-the-art care for people who are HIV positive. So this fund is well known for providing indigent care on a day-to-day basis, and probably a little less well known for those careful investments made in the future of healthcare in Manatee County. So now it's 2015. You hang around with Jonathan Fleece, you start to think about the future. This is the year the Healthcare Trust Fund is projected to be exhausted. And so the solution that was devised in 1984 lasted 31 years. The actuaries at the time predicted it would last 10 years. It was never meant to be a long-lasting it was meant to be a long-lasting solution, but not a permanent one. Today in Manatee County, 3 main groups pay for health care. Employers, which is why the Chamber is very interested in this issue and has devoted a lot of time an effort producing a healthcare study, supporting the launch of the Healthcare Alliance, the patients themselves, and county government. And when you look at these three groups, county government is the smallest contributor. Employers are the biggest contributor, and families come next. So I'd like to emphasize that we've got to address the healthcare cost concerns and the healthcare access concerns of all of these three groups if we're truly going to serve our community. Briefly, I want to highlight some of the worthwhile ideas generated by the study groups appointed by the County Commission. The Healthcare Access Group included many healthcare leaders and community leaders. I served on that for 3 years. They came out with some recommendations. The Manatee Chamber of Commerce produced a study that was conducted by University of South Florida. They produced some recommendations, and I'm going to bring forward a few ideas that I think really have legs and the potential for transformation of healthcare in this community. Set a vision for improving healthcare outcomes in the county and meet it. Improve access to healthcare by improving patient knowledge of how and where to seek healthcare and how to achieve prevention and wellness. Remove impediments for prompt and integrated treatment of care by better coordination of care for the patient among hospitals and practitioners. By its very nature, our very worthy hospitals and practitioners are fragmented. We live in silos and we try to work together, but it's not a smooth highway always for the patient. Lower the cost of care by integrating healthcare information and eliminating unnecessary duplicative procedures. And people sometimes get tests over and over again because the next provider doesn't have the results from the provider before. Address workforce needs, including physician training and retention. Manatee Memorial is embarked on physician residency programs. Manatee Glens is applying for a psychiatric residency program, and our workforce committee at the Healthcare Alliance and Suncoast is working on these same kinds of healthcare issues. And divert inappropriate utilization of the emergency rooms. For some people, that is their source of primary care. Manatee Rural Health Service is waiting for pregnant women to give them care, but they're not getting there. So we've got to change some of the healthcare seeking behavior and divert people from the emergency rooms. I'd like to add a personal note about diversion and say that we should probably add diversion from nursing homes. The county pays in excess of $4 million a year to match Medicaid nursing home in this community, and also diversion from jail. County pays in excess of $5 million a year for healthcare services in the jail. I want to mention that the county has been a leader as an employer in promoting health and wellness and integration and integrated behavioral health care with their employee plan. They've had fabulous gains in weight loss, tobacco cessation, just a marvelous model. And Manatee Glens is proud to provide the behavioral health in that integrated plan, so I commend that to local employers. I think we're at a historic juncture once again, and it's going to require, once again, visionary leadership in our community. The Healthcare Alliance is emerging as a platform for collaboration where business and healthcare and education and community leaders of all types can forge that vision. I invite you to join. It's not a closed group. You can weigh in with your expertise and your ideas and your vision. So I close with a futurist view. 10 years from now, what is Tiger Bay going to say about healthcare in Manatee County? Will we be talking about what a narrow and self-interested view we all took of the problem and how we kicked the can down the road? Or will they say we took a broad look at community welfare, that we worked hard to transform our healthcare system as a national model? Well, invite me back in another 10 years and I'll let you know what I think.
I think it's going to work. I have been playing IT guy over in the corner at the laptop, so we will see if this clicker works. And if not, then we're going to go back to the manual advancements. I'm going to begin today with 2 quotes. When you practice law with Cliff Walters for 10 years, who I know couldn't be here today, but I think Susie's here, you start to live your life by metaphors and quotes. So I'm going to open with 2 quotes. One is think globally, act locally. And 2 is the famous quote by President John F. Kennedy, ask not what your country can do for you, but ask what you can do for your country. And that's really going to guide my presentation, and it really guides my life as a proud member of Manatee County. I am the board chairman for the Manatee County Healthcare Alliance, which we're going to share a good bit of information about. I'm also the chairman of the Manatee Chamber of Commerce Healthcare Committee, which I'll touch on. Serve on the board of the chamber, also board of trustees for Tidewell Hospice, am with Blaylock Walters Law Firm and head the healthcare law practice group, and am the co-author with David Houle of a new book, The New Health Age, The Future of Healthcare in America, which I'll call upon some of that research as we chat. So why am I involved beyond just the quotes that I shared? I am a proud but yet concerned resident of Manatee County, Floridian, and American. And that really is the simple truth as to why I'm getting involved in these issues. Our healthcare challenges are great, not just locally, but at a state level as well as a national level. Our costs are some of the highest in any industrialized nation in the world. Speaking of the private sector, as Mary referred to, on average in the year 2011, American businesses spent over $12,000 a year per employee for healthcare costs. Healthcare expenses are approaching 20% of our gross domestic product. That again is one of the highest rates in the world as an industrialized nation. And by 2020, at our current federal budget expenditure rate, 50% of the federal budget will be taken up by Medicare without some sort of change and reform to the cost to the Medicare program. We've touched on access. Nearly 50 million Americans have no access to health care, and those statistics play out here locally, so we have a major access problem. The delivery system has a lot to be asked of and is being challenged more and more. And when we look at our state of health, it is really very abysmal. As Dr. Bensi alluded to, we are not a healthy nation. Nearly 2/3 of Americans are overweight. Only 1 out of 4 Americans regularly engage in physical activity. Our chronic disease rates are skyrocketing. Our state of health is really very poor. So that's why I'm involved. Our economy. There is no doubt, no question that our economy needs stimulus. Our economy needs help. And when we ask businesses across America, which David and I did as we wrote our book, we are losing as a nation our competitive advantage, not just because of our state of health and the state of our workforce, but because of the cost of providing health care to employees at that $12,000 per year. How are we going to compete against emerging markets in Asia, South America, and other parts of the world with our costs so out of control? And all those issues trickle right down to Manatee County as well. What does all this mean? Ask your yard guy. Ask your small business if you're not a small business. Ask the big businesses, the migrant workers, and the taxpayers. It means we've got to fix the problem, is what it means. So where do we go from here? I am proud to say, after spending nearly 2 years writing the book, The New Health Age, being involved with the Manatee Chamber Healthcare Committee and leading the Healthcare Alliance, that I stand before you with absolute great hope that while we are going through a transition that is very, very challenging, dynamic, and stressful to many, that we are on the verge of a much brighter and better future in America, and that's why we've called it the New Health Age. And as we share what the Alliance is doing, I think you will join me in that hope, and we will ask that you all help participate in some of the initiatives that are going on right here locally in our own community. So what did I learn when we wrote the book? The tipping point is now. You can look at economic cycles of all sorts, real estate certainly being one that we've recently lived through. At some point, when the challenges become so great and so constraining, it forces change. And that tipping point has come because of all the factors and the data that we presented to you. We are entering a new time, and I think this next bullet is critical. America, Florida, Manatee County, all of us, we have gone through challenging times before as a nation. Go back to the Civil War, go back to World War I, go back to World War II, the Cold War, terrorism. Challenges have confronted this country in the past. We will get through the current challenges and the transformations that are facing us with a healthcare crisis that we continue to have in America. And by acting locally and doing your part and my part, we can help move us forward. So where are we? I can tell you, after interviewing folks from literally California to the East Coast as part of the book writing process, that we have no better leadership in America than exists today in Manatee County to solve this problem. And I'm not just saying that as a citizen to make us all feel good. That's truly a fact. And just to give you an example, we interviewed individuals like George Halverson, CEO of Kaiser Permanente, one of the largest healthcare systems in the United States. And I am convinced that we have that kind of talent here in our local community to solve this problem. Let's look at our own county employee health plan as an example. I don't see if Bob Goodman, is Bob here? Or Kim Stroud, where is Kim? Kim. We have one of the best examples in our employee health plan within our own county government that exists. It's an employee wellness initiative that really brings a culture of health into our own county government, our own county government employees. And if you don't know about it, introduce yourself to Kim and the commissioners and the other administrators and learn about it, because it is reducing costs, it's addressing chronic disease, it's impacting lifestyles, and it's making our county employees healthier, it's saving us taxes, and it is an incredible model that all of us can use and emulate in our businesses. Manatee Glens is another small business that's implemented employee wellness programs and lifestyle change programs within its self-funded health plan. And she has, and the Glens has driven down their cost to approximately $6,000 per employee, while I stated earlier that the national average is $12,000. And I don't know if he was supposed to, but Bob Goodman, who I know works a little bit with Manatee Glen, shared with me some new data, and I know that you're continuing to show great improvements in that program. So we have wonderful examples right here. Community involvement, we all know what Manatee County can do when it comes to our own citizens and community involvement. The Chamber and our Healthcare Committee and the Alliance, which we're going to talk about in a minute, are just two examples of why we care and what we do. So let's jump right into it. Quick history, and then we are going to open it up for questions. Mary mentioned the healthcare task force that sunset a few years ago, and immediately following that task force, the Chamber partnered with the University of South Florida to do a major healthcare study of the state of health in Manatee County, and out of that study was birthed the Alliance. And when you looked at that study, and for many of you who participated in the think tank program that we had about a year or so ago, these 6 areas, and for those of you who can't see over here, I'll go through them, were really the key components to where the community decided we should be focusing our efforts and developing our action plans. One is around legislation and healthcare reform. And Dr. Stephen Leedy, medical director with Tidewell, co-chairs that with Kevin DeLallo of Manatee Memorial Healthcare System. And I'm going to embarrass everybody in just a minute so they can stand up and at least be recognized. Funding is the next task force, and right now that is being chaired by Mary. She is looking and seeking out her co-chair at this point. The third task force is Education, Wellness, and Prevention. Judy Sedgeman, who you know, co-chairs that with Steve Hall with All Trust Insurance. Healthcare Coordination and Integration, Mickey Prichet and Jill Stoplis with We Care. Workforce Development, Dan Frederick with Blake, and then Leslie Lovelace with the Workforce Board. So for those who are here who have been very active chairing these task force, if you would please stand, I would like to recognize you for all of your hard work. So where does the Alliance go from here? And then we will have some time for questions. One, I will repeat myself, think globally, act locally. Many of you are already members of the Alliance, but those who are not and have an interest in this topic, please get involved with the Alliance. While the funding right now to be a member is fairly inexpensive at $200 per organization, we are looking at that model and trying to determine what's the best model to support this nonprofit going forward. Thinking about many different ideas that the Alliance can implement there, but right now it is $200 per member. All of these task force have action plans that have been very well discussed, rooted, and are now taking life. We don't have time to go into all the different action plans today, but I assure you that they are bold, they are exciting, and they are grassroots to cut to the core of these issues that we've been talking about today, to truly help America move into the new health age, which again I believe is happening and is very possible here in our own community. I also, by the way, see Bob with the school board in the back, and they're another great model of a wonderful employee wellness program that's led by Christy Dickerson. So again, many active, engaged parties in this project and in this movement to really bring health to our community. So with that, that's the Manatee County Healthcare Alliance at a high level, and I think it's appropriate to go ahead and open up for questions and discussions. But thank you so much for your time and listening to our information.
Okay. Well, thanks to our panelists. Of course, Commissioner, are you coming to the mic? Okay. You could start. Yeah. We're going to take questions right now.
I'm Carol Whitmore, and I'm a member, and I'm also a member of the Alliance, and I was actually in the audience the day they sold Manatee Hospital as a nurse. My husband's a physician, and as soon as Friday, I worked at the Homeless Coalition with my husband where he does surgery on the homeless, and out of the 5 patients, we had 7, but it rained, so 2 didn't show, but out of the 5 patients that showed, 2 of them we immediately had to send to the emergency rooms. 2 of them, the problem had gotten so bad because my husband only comes once a month that now we couldn't do him in the office, we had to do him in the hospital, and 1 we could probably do next month. I'm an impatient person. I'm a nurse. Elected, the elected office, you tend to take your time, and it takes years to get something done. Mary, I think you're the only one that can help me in this question. We have very important issues coming up real soon as far as funding. Paying the jail $5 million a year to take care of our inmates seems like a lot of money to me. I just need to know, Mary, because I know you've been around a long time, as long as I have, what are we going to do now? I mean, I'm on the funding committee for those of you that don't know, but what are we going to do now? Because our money runs out in 2015, and it's not going to get better. These people are still losing their jobs. They're losing their health insurance. I spoke to a doctor last Friday in the parking lot. He's laid off everybody in his office but his receptionist and him. So it's a problem, and I don't know where to go or how to help.
Okay, we get it.
Sometimes it has to get worse before it gets better. The economy has had a terrible impact on people's access to care. I think I can speak for every hospital in the county. We've seen increased indigent care The same people are coming, but this time they don't have insurance. I know you've seen it at Manatee. We've seen it at Manatee Glens. It's certainly true at Blake. And so the economy has heightened and worsened the situation. I think what we can do, Commissioner Whitmore, in the next 3 years is quickly identify the things we can do ourselves with nobody's permission in this community. We can integrate through information, we can co-locate, we can find ways to expand access to care by removing barriers that we have control over. We can deliver health care differently. And the one-stop center that you work in is one example of that. We started in 2004 with the idea, and it's now the Bill Galvano One-Stop Center, where dental care, primary care, specialty care, behavioral health, preventive care, all the providers are grouped together to serve the homeless. And so that's the good news. The bad news is now we're seeing how bad the problem really is. So I think we have a good year to do serious planning, to challenge ourselves to change the things about healthcare in our community that don't make sense to anybody if we really think about it, and then make a plan for how we implement a vision which I hope will rest on improving healthcare outcomes for everyone.
Okay, next question. Try to ask the question briefly if possible without a long statement, because we're hoping to get a lot of questions.
Marla Huff with Huff Engineering, and I'm a member of Tiger Bay. My question is regarding the Blake Trauma Center. I know some of the competing hospitals filed lawsuits and tried to badmouth Blake, but I'd just like to hear, it seems like a positive to me, how is the Blake Trauma Center working?
I'm a board member on the Blake board, so I can give you my perspective. I can't speak for Blake, of course, unless Dan Friedrich is here. I didn't see him. No, okay. The Trauma Center has already seen 3 times as many people as we thought and planned for in the budgeting. There are people, there's one gentleman in particular, he was crushed. Basically, he was cut in half. I mean, he lost both his legs in a terrible accident. He would not be alive today if he had to be bay flighted out of this community. So I think the need has been demonstrated. It has saved lives, and I think there's a general benefit to all of us, whether we're a trauma victim or not. Physicians will tell you that prior to the trauma center, there was no emergency room where people who did hand surgery were available on call, or who did maxillofacial surgery were on call. OBGYN trauma surgeons. These specialties are now available to every last one of us round the clock, whether we're a trauma victim or not. And so I think the Trauma Center has elevated care for all of us in the community. And I, for one, as a mother of a trauma victim who had to be bay flighted out to Tampa General because All Children's was full when my son at 19 got in a car wreck. And I had to drive up to Tampa to attend to him and for his follow-up care. And I'm a woman with a car and the money to put gas in the car and the means to pay for that care. And so I'm glad that the moms who don't have the benefits that I have the Blake Trauma Center. Hope that answers your question, Marla.
Okay.
This is for Jonathan. Jonathan, first of all, your book is great. I'm with Manatee Diagnostic Center and MRI Center here in Bradenton. We do about 260 exams a day, and it is a life-changing time for this nation, and your book really points that out. I want you to speak about what we talked about downstairs in the lobby, and then I talked with Congressman Vern Buchanan about the movement that citizens are taking in this country for offshore procedures such as hip replacements, bypass surgery. I'm going to state what you stated in your book. In 2007, 750,000 Americans went offshore. In 2011, 6 million went offshore. and just talk about that and the brain trust that we have that will possibly leave this country.
Wow, Davis, I don't know, does that qualify you as a groupie? I really appreciate those humbling words. Yes, there is a major trend in healthcare to leave the United States to receive healthcare for a variety of reasons. Cost being one, quality being others, and frankly, other countries getting more competitive in the whole healthcare space and providing a product that Americans are finding valuable. Dr. Shetty is a gentleman you can Google and look up from India. He opened his first heart hospital in India several years ago. They now are doing comparable numbers of heart surgical procedures to some of our major national medical centers at a fraction of the cost, with lower mortality rates, lower infection rates, and really doing a better job at quality. He, after that, opened up a children's cancer hospital right next door and is soon to open another hospital now in the Caribbean, and is planning to have his own jet service to basically jet Americans from Miami to his new hospitals in the Caribbean and provide what he reports to be very, very high quality health care for a fraction of the cost. So it is a growing trend. That said, as I opened the slide with, I am a proud American, and yes, we're going through transitional times, but we have one of the best health care systems and foundations in the United States that exists in the world. I'm convinced of that. The data is not showing it because we're completely re-engineering ourselves at the moment. But in 10 years, Mary, when Tiger Bay holds its next meeting on this topic or before, I am convinced we will be reporting better data to you, and it's going to be coming a lot out of this community. So, thanks.
Chris Pennewell with Whitney Bank. I'm a member, and this is for Dr. Bensi. Actually, I have two questions based on your presentation. I think you said 2/3 of all babies are born in Manatee County at Manatee Rural Health. So does that mean 2/3 of all babies in Manatee County don't have health insurance? And the second question is, I think you said you were ranked 21st out of 67. What are we good at? Like, a lot of times those rankings are obviously a bunch of different things. What brought down our rankings, and what do we really did well in comparison to the other counties?
Okay. If I could answer your second question first, because I want to ask Mickey to help me with your first question. But this is the rankings I was talking about, and it only started 2 years ago, and the next round will be out next month from Robert Wood Johnson and the University of Wisconsin regarding the health of each county. What they did was they looked at the following indicators. 30% were health behaviors, so that's tobacco use, diet, exercise, alcohol, and unsafe sex in the community. 20% was clinical care, access, and quality. Social and economic factors made up 40%, included education, employment, income, family and social support, and community safety. And 10% was physical environment, so your environmental quality and your built environment. So based on those indicators, those numbers were given to us. And then each one is broken out so you can see where we rank in each of those areas as well in the book. And again, it's available online, County Health Rankings, University of Wisconsin. So we'll be getting the next round, as I said, in April. So it'll be interesting to see how we do compared to last year. I'm hoping for the better. But I think they're very, very good indicators, and look at morbidity and mortality overall through these. The other part of the question, Mickey, I'm going to ask you to talk about, from what I've been told, 2/3 of the women see your OBGYNs and they deliver the babies at the hospitals. Is that correct? And could you comment on the insurance?
Yeah, for the most part. Can everybody hear me? Okay, for the most part, the people don't have commercial insurance. About almost 50% of our people that deliver do have Medicaid. We subcontract with the health department to provide OB care and, of course, Healthy Start. So we have almost everybody has a payment source, but they don't have insurance.
Okay, thank you. Okay, we have a guest. Dr.
Yeah.
Scott Connard.
Hi, yeah, my name is Scott Connard. I graduated from Manatee in 1978, so I'm kind of a transplanted. I live in Dallas today, but I have a question for Jonathan. And you were talking about earlier that the providers, the employers, are the ones that pay the majority of health care in Dallas, in Bradenton, in Manatee County. So yeah, I know where I'm at. And so, Jonathan, I was just going to ask you, I love your book. I thought it was fantastic. When you look at Manatee County, what do you see as the 2 or 3 things that businesses really need to step up and do in Manatee County to get the transformation moving ahead aggressively to transform this problem?
That's a great question, and there's a lot that can be done. And for those that are really interested in this topic, I encourage you to introduce yourself to Dr. Scott Connard after this meeting, who I've had the pleasure to meet, and he has a wealth of information. But I'm going to answer it very, very simply. It's all about a movement, and it's all about lifestyle change. And I'm going to actually use that excuse to answer the question this way. A call to action from our book is called The Race to a Healthy America. And many of you may have seen the Chamber publication and marketing about a program that we're doing on February 29th of this month out at the Lakewood Ranch office with David Houle and I, that is really about the race to a healthy America. And the race is being driven by businesses across America to make America the healthiest nation on earth by 2025. And it's about bringing a culture of health into your organization down to really the DNA level, because it is not appropriate to blame the healthcare delivery system wholeheartedly and access issues for this problem. We as a community have got to start taking responsibility for our own actions. And there are very, very good models that Scott's company is familiar with and he has experience with as a physician that the Glens are implementing to try to motivate employees and encourage our workforce at really, as we've said, the core of this issue to move towards a healthier lifestyle and to join the race to a healthy America. It's about our nutrition, what we choose to eat, what we choose to drink, how much we choose to eat and drink. Yes, the healthcare system is part of it, and research and technology and a lot of the innovations that are coming in the 21st century are as well. But I think to answer the question succinctly, learn about the Race to a Healthy America through the Chamber this month. Join the initiative to bring a healthier workforce to your population. We've got some other experts in the room. Dr. Laurier, who has opened up an entire medical practice here locally around this entire concept of lifestyle change, prevention, screening, to try to bring the healthcare costs down and make Americans healthier.
I think one of the biggest tools that employers have at their access is how you design your benefits. Especially if you're self-insured, but even if you're not, you're still the purchaser. And so at Manatee Glens next year, you can pay yourself $5 a pay period if your cholesterol's within measure, if your blood pressure's within measure, if your BMI's within measure, if you stop smoking. You can give yourself a raise. Now, there's also a stick. If you don't take your health risk assessment where we know what all those measures are through our health plan, you don't get the same level of deductibles and copays. And so I think, you know, I see it all the time in the behavioral health side where an employer will have adequate inpatient benefits for behavioral health and limited benefits for outpatient. Can I say duh? You know, so the health benefit design, that would be the single greatest thing that, and I see you're agreeing, that the employer can do.
Rusty? You have a question?
I'm Rusty Russell, and you know, this is a political year, and I have not heard any comment from any of the three of you about Obamacare. And I would like to hear what reaction you have to that and any other comments you might make. Thank you.
I'll let you take it, Jonathan.
The challenge that we as Americans have over the topic of healthcare today is that we have made too much of the discussion a political discussion. And I'm certainly not going to stand before an intelligent audience and try to convince you that the topic of healthcare is apolitical. Of course it's political, because our policymakers are responsible for many, many laws that guide healthcare policy at many levels. But the reason that we have not focused on it today is because most of what we've talked about today is really apolitical. The decision to make businesses locally healthier and our workforce healthier, and implementing effective employee benefit plans that Mary referred to, that's not a political issue, that's a business issue. Many of the issues that Dr. Bensi discussed today are societal issues that, again, are not political. So yes, we can have the political discussion, but today that's really not the point of the presentation. It's about what we need to do to bring this community together, regardless of party, regardless of color, regardless of religion, regardless of age. What can we do to bring this community together to rally around the race to a healthy America so we can move this community forward?
I'd like to comment on that too, as the moderator or the planner of the program. I think we, as Jonathan said, the most important thing that we can do in terms of having intelligent, informed, civil discussions of healthcare is to focus, as Jonathan said, locally, and the global things will take care of themselves. You know, certain things get mandated, you have to deal with them, but we also, as a nation, no matter whose law ultimately prevails, as a nation, we have to deal with the healthcare issues that are being raised today, and that starts locally. It starts with decisions that are made right in this room. Yes.
Good afternoon. My name is Dr. Scott Clulo. I'm a member of the board of the Manatee County Medical Society, and actually next president-elect for year 2013 of that organization. I'd like to thank Manatee Tiger Bay for having this topic. It's kind of one of my passions of talking about healthcare and delivery. My question, and thank you the board as well, or the panel, my question really was, you know, as a primary care physician who has seen and dispensed healthcare to the county program employees in their wellness and prevention program, which I think is excellent and should be instituted nationwide. I would like to know, in small businesses that may not have that opportunity to have those kind of programs, what is the Healthcare Alliance or the county doing to help those small businesses do to implement those kind of programs for their employees?
The health department has a worksite wellness program, so I have teams going out every morning. Predominantly, we work with the schools system employees, but we are available. So if you would like to contact me, if you want that assessment done, and we have the teams that come out regularly, the nurses and the health support techs that do the different studies, biometrics or whatever you want to call them, and then continue on with the education and the policy components as well. So we're definitely here to assist anyone in the community.
And that's another access issue. There are a lot more resources available to people than people know are available. And another aspect of the Manatee Healthcare Alliance and the committee that Steve and I co-chair is to get the information out there to really do a better job educating everyone in the community what's available to them, how they get connected to it.
Mention the chamber website.
Oh, and the chamber, yeah, the chamber website. ManateeHealth.com has a lot of information. Okay, Greg, this will be the last question.
Could I just, this has been a wonderful presentation. It's representative of what I think Tiger Bay is all about. I'd like to ask all of the Tiger Bay members present, would you please raise your hands? Now, those of you who could not raise your hands, there's a cure for that. And it's on your table. And if Tiger Bay is to continue to exist and to continue to have programs such as this, we need to cure you. So please become a member. Thank you.
That was brought to you by the Department of Shameless Promotion. So,
I have one comment. Is
Yes.
he practicing medicine without a license?
well, it's nice to end on a light note. I want to thank you all very much for coming. Our next meeting will deal with the issue of charter schools, which is a lot of people are very interested in right now. There's a lot going on in that arena. I would like to ask the board members, as I said before, who are willing to take part in our public service announcement to stay. And if you're going to mill around us, please. Thank you so much for your coming and for your attention. Thanks to our wonderful panel. Have a great day.